It's 7 p.m. and I've just arrived onto the ward. It's time to check the controlled drugs cabinet to make sure that what the day staff says in stock is actually there and nothing has gone astray. We begin with the opioids, or pain relief as you may know it better. It looks like we are running out of morphine, so I document this in the pharmacy order form. It takes time to check that all drugs that have been used throughout the day have been accounted for. Anyhow, after this, I meet with the rest of the night shift team and we attend the handover together. One of the nurses from the day shift will now give us a breakdown of all the patients on the ward, whether we are expecting any trauma admissions and if there are anyone due to go home soon. It's 7:30 p.m. After making notes quickly about each patient on the ward, listening to their full medical history, what allergies they have, what medications they are taking, what treatment and plan of care has been prescribed, what recent blood tests showed, what their diet is like, and whether they need additional help with eating and drinking, or toileting, or mobilising. We then start our shift. It's about 8:30 p.m. As the day staff leave, we start to manage the ward. With 40 patients in our care for the night, and a total of 3 staff on duty, we already know that it's going to be tough, and that we might not even get a break. Between the start of shift and the end of shift, we have lots of duties to carry out. Quite often we have to carry out similar tasks throughout the night also. Things like checking vital signs, recording fluid balance charts, administering IV medications or pain relief, contacting the doctor frequently to prescribe medicines, escorting patients to x-ray, taking blood tests and lots of other clinical skills. All the time, responding to queries from family and patients, responding to buzzer alerts from patients throughout the night, assisting with toilet needs, dressing and changing of wounds, recording and updating of care plans, communicating and reassuring patients. When we have everyone in bed, all tucked up for the night, our duties never end. Sometimes we get a call in the night, or a hospital manager calls in to let us know that there has been a serious accident, or that we are needed on different wards for a few hours. We need to be able to work really well as a team, and we need to be able to communicate quickly any updates on patients' health, because if I'm called to work in A&E during the busy times in the wee hours of the morning, the 2 other nurses will have to manage without me. Or if we get multiple admissions, we need to act fast so we don't disturb the other patients who are sleeping, as well as ensure the patient being admitted feels safe, comfortable and aware of the treatment until the morning. Quite often they need to have surgery during the middle of the night, and that requires us to monitor them both before and after the surgery. Nursing at night is quite different to the day, but I like it. I get to talk to patients who have had their surgery early in the day and who are feeling better or more relaxed on the ward. I get to listen to their stories and get to know them. I also like working at night because, although there may only be a handful of staff on, we get to manage the ward, which can be challenging at times, but I like a good challenge. As the day starts to break and we start to see some light, we know our shift is nearly over. So we get busy again, checking in with the patients, making sure that they are pain-free and that they are not deteriorating. We help the patients who are due for surgery today to get up and dressed and ready for surgery. We tidy the spaces that we have used, we clean bedpans and toileting areas, we change sheets on the beds, we get the ward ready for the day staff who will be arriving around 7 a.m. to check the controlled drugs, and the ward cycle begins again.